It's Dr. Darlene Thomas. Welcome to Sage.
Thank you for inviting me.
You're very welcome. We've been looking forward to your interview.
And I've been looking forward for the interview also.
Before we begin, I'd like to ask you a few questions. Can you tell me a little bit about yourself?
Yes, I started out in the healthcare field in 11th grade, working at Blossom View Nursing Home, where I cared for patients that was elderly mainly. I started working there as a nurse's aide. I went on with my education, and then I obtained my LPN, my licensed practical nurse. And then I went on for my associate's registered nurse, and then went on for my bachelor's RN registered nurse. And then I completed my master's degree, and then I completed my family nurse practitioner course. And finally, I completed to the end my doctorate degree.
How many hospitals did you particularly work at?
I actually worked in mainly two hospitals. That was Auburn Memorial Hospital, which I started in as a registered nurse, and Emory University Hospital in Atlanta, Georgia.
During the COVID-19 pandemic, I'd like to ask you some questions about that period. What were some of the initial challenges you faced when the pandemic began?
One of the initial challenges we faced is dealing with a virus, a pandemic virus that we really wasn't familiar with when COVID actually started. I had been in the healthcare field since I was, as I said, in 11th grade. And one of the scariest things and one of the saddest things was I've never seen in my whole career, I've never seen that much death in people before. I have seen people die, but not at the rate that I saw. It was just really sad because we would see the families come in and stand at the ICU door, and we knew at that time that that patient's family member had either died or the family member was about to die. They only had about like 10 minutes, 10 to 15 minutes to come in and see the family member before they passed. It was just so sad to see all the crying, seen crying before, but not like that. The pandemic had really changed our outlook, the healthcare field outlook of death. And it just was something we knew how to treat the symptoms, but we didn't know how to actually treat the diseases. And sometimes even when the patients received treatment for the symptoms, they still passed at that time. So it was something that we wasn't used to, because usually when there's medications given, the symptoms are treated, then the patient in the ICU is maintained better and eventually go home. Not all of them before the pandemic, but the majority of them. And it was like every single week there was multiple patients dying of the symptoms from COVID. And it was just something I had never experienced in my life in the healthcare field.
How did you and your colleagues manage the emotional and mental strain?
Well, we was a team. In the healthcare field, you're a team. We were used to working together on that floor. We comforted each other. We talked to each other. We cried together. Not only just myself, there was many of us, nurses, doctors, therapists. We was able to comfort each other and then talk to each other about comforting the families. We comforted so many families. It was just a strength that we had built up in being in the healthcare field for so many years. We were expert nurses, expert doctors. We've seen tragedy before. We helped the patient's family and comfort them as much as we could, which gave us comfort We couldn't take away their pain, but they saw that we really cared about them. They saw that we really cared about the family member that had passed.
How did you handle communications with patients and families who were unable to visit due to restrictions?
It was like a telehealth. Sometimes we used the family member's phone. We were able to have them talk in like a Facebook so that they can see their family member if they weren't able to make it and see what last words they wanted to say to their family members. That's how we were able to have them communicate with each other so they could get some closure.
What were the most challenging aspects of managing healthcare staff during the shortages? How did that affect everyone?
A lot of healthcare facilities have short staffing, and so did we. We had some short staffing there. I was one of the team leaders. We had a plan, but we had to change that plan. We just collaborated together. We communicated with each other effectively for what the plan of care was. How were we going to deal with the families? We had chaplains come up to the floor. It was a collaborative meeting together on a daily basis. Okay, this is how we're going to deal with this. This is how we're going to take care of this. We were just really fitted together.
How did you handle the patients that were already in the hospital?
Yes, that was a challenge. It really was because the floors were every bed was filled. As I said, we just worked as a team. There were different ages of people that were dying from the pandemic. The younger ones, the middle-aged ones, the older ones, and we seen the families coming out crying. It was devastating. We just had to comfort them, and we had to really comfort ourselves because it's an emotional roller coaster that we was on because we were having difficulty all the time just looking at the death that was in the hospital. So it was just something that was abnormal for us with that much death to happen at one time.
Can you give us a feel of what the beginning stages was like? Can you just walk us through the beginning of COVID?
Yes. So in the beginning at Emory, there is a phenomenal management, and they kept us updated about how serious the COVID was and the amount of patients that is going to be coming in and how we need to try to make sure we were prepared for that greater influx of patients coming in with the critical to a deadly virus. So therefore, in the beginning, it was kind of difficult because we had so many beds filling up and we had to have enough staff where we had to maintain the same excellent care that we have given patients all along. They needed excellent care. They needed critical more than anything. And we did everything that we could to make sure that we maintain quality care. COVID is still relevant today. But when it started calming down a little bit, that we thought was calming down a little bit, that COVID appeared again. And it started being just like in the beginning. It was always critical care. We had our face shields on. We had our hair covered. We were in all kinds of what we call PPE, protective equipment, because we were used to wearing masks, but we weren't used to wearing 2 and 3 masks at one time. And these weren't just regular masks. They were specialized masks. We had to have the face shield over. Then we had something covering our head. So in all of that, it was really hot with all the equipment that we had to put on. It was just unbelievable. Some of our faces had welts on it from the ropes from the mask, and it was so hot in there. Sometimes we had to walk out of the room, get some air, and then come back in there. it was just something phenomenal. It just was unbelievable. But we still maintained because we wanted to maintain the patient's health and we wanted to maintain our health. It was important that we maintained our health so that we can take care of the patients that were critical with COVID.
What were some of the biggest surprises?
The amount of death. I just think the biggest surprise was the amount of death and the diagnosis that we knew, regardless of the treatment, that we couldn't save them. Because in the healthcare field, we help heal. We help get people better. We help maintain their health where they can be discharged from the hospital and be healthy after a care plan that we have built for them. But we knew we could not save the patients. And that's devastating for any nurse, from any nurse's aide, from any doctor, from any anesthesiologist, from any staff member, because we're used to saving patients. We weren't used to losing that many patients in a short period. That was the most devastating that we had.
How did everyone avoid being burnt out during these times?
I think it was almost impossible not to be burnt out. It was hard emotionally. It was hard physically because we were on the go constantly. Sometimes we couldn't take breaks, not because we didn't want to, but we had to get the care to the patient. And it was difficult.
Was there misinformation coming in at that time?
No, I wouldn't say there was misinformation. There was new information from the CDC, because Emory definitely, follows the CDC and the guidelines. Because COVID is not a new disease, but it is a virus that we have dealt with way back in some years. But this was just a new strain that we weren't used to, that we didn't know a lot of information about. We had information in our emails on a daily basis. They had group chat where we can ask questions. So there really was no misinformation, but a lot of new information that we had to learn. We always had information about what was going on and how to try to deal with it, how to try to diagnose it, how to try to treat it. And there's other, groups that we can talk to, other physicians that we can talk to, other nurses we can talk to. So it was a collaborative experience where we all understood what was going on. And we all understood that we treated the symptoms, but that might not have saved the patient's life. I don't know if you know or if other people know, COVID is a virus. You never get rid of a virus. It just stays dormant in your body. And then when something happens, it sparks it up, like a common cold. Cold keeps coming around every single year for most people. COVID hasn't died. It just has decreased itself.
Can you talk to us about the vaccine?
I would say definitely follow the instructions of your doctor when it comes to the vaccines. COVID has spiked again, not as deadly as it was before, but people are still dying from COVID.
Do you believe that prayer can have an impact?
Yes, patients are more vulnerable when they're in the hospital. They're sick. They want help. I'm talking about spiritual help, and they have us pray with them sometimes. And prayer, a lot of people, they have been taught prayer, and they revert back to that when there's something that has happened to them, and they know that I don't know if I'm going to make it. Therefore, I think Jesus Christ has definitely entered into a whole lot of people's minds.
How did your personal faith influence your decision making?
A lot of the patients, they knew I was a preacher's wife. They knew I was a missionary in church, and they knew I was a doctor. So they would ask me to pray for them. And one of the best ways to help people is to take care of them, sing to them, talk with them, take time with them, show compassion to them. And I still think about, I want to help people. A little girl, me and my mom was watching TV. I seen a man laying in a bed with a hospital gown on. There was this nurse. I didn't know it was a nurse at the time. And I asked my mother, what is that lady doing to that man? And she said, she's helping him. God gave her the exact perfect word to say. I'm like, that's what I want to do. I want to help people. I still think about what my mom said, and I still think about, I want to help people.
What motivated your decision to retire at this time?
I absolutely love the healthcare field. I look back to when I started working at 17, when me and my husband had the conversation. I said, you know what? I'm financially stable enough to be able to retire. I still love the patients. I still love staff, but it comes a time where I wanted to fully enjoy my life and enjoy my family.
Looking back on your career, what are you most proud of?
I'm most proud of the patients that I provided care for, that they were pleased with me. They were comfortable with me, and we formed a bond because they knew I cared about them. It was like family. They were great patients.
What legacy or impact do you hope to leave behind?
I would hope that I leave a legacy of caring for patients, having empathy for patients, being a team leader for patients. I would hope that my medical knowledge have inspired other colleagues through communication skills to continue to collaborate the best care to ensure that all patient needs are met from starting admission to the discharge, so that the patient will have no misunderstanding, will have all the information that they need, and just loving patients.
That sounds beautiful. What advice would you give to the next generation of medical professionals?
The medical advice that I would give to the next generation is to love your patient. Never stop learning. Increase your knowledge and your skills, because this would provide better outcomes for patients and build a trusting relationship with your patients.
Is there anything else that you'd like to add?
Yes, I would like to thank you for allowing me to come on stage. And I just want to thank you for all the questions. Thank you for everything.
You're very welcome. Thank you for coming on to stage. Dr. Darlene Thomas.